Welcome back to ABC-7 at 4. It's a type of depression that can happen during the changing seasons. Most of the time, those experiencing seasonal depression feel it in the fall and winter, but some may not even know they have it. And joining us now is Dr. Ogachika Alozi to talk to us about seasonal depression. Hey, Doc.
Hey, how's it going?
Well, for those that aren't completely sure, can you just explain to us what is seasonal depression?
Well, I think you sort of identified it already, right? So in the winter months, especially in the United States, because we change the times backwards, right? It gets darker, we fall back, and it has a lot of things that happen in the body, which we'll talk about in a second.
Well, some people may experience the winter blues, but they may not even know that there's a medical term for it. So talk to us about the affective disorder and the symptoms.
Yeah, so SAD, which is seasonal affective disorder. And like you said, it's the winter blues. I actually know a lot of people who have had it. One of the reasons that I moved from Minnesota to El Paso back in 2010 was specifically about that. There's individuals that can have mild symptoms. You feel a little bit down, the time change, you get tired, and activities can change. Just hanging out with people that you know, family members, eating healthy can be important. But if it goes beyond that 2 weeks, that's when it starts to be a problem.
So how can we prevent the winter blues? Can we get cozy? Can we relax? What can we do?
Absolutely. So I think, first of all, we got to sort of give people a background of why these things happen. People know about serotonin and melatonin. These are both chemicals in your body. And again, the darkness and change in time actually changes the concentration of those in your brain. One of the other things, and this is really important because there's actually some laws that might be going into effect in the next few years that will stop falling back in the winter months, right? Your body's circadian rhythm or your biological clock actually changes, and that can actually make you feel sad.
So what type of activities do you suggest to help someone feel better?
Well, I think it all depends. So if you've had these things going on for more than 2 weeks, you've tried to get out and about, you tried to engage with your family, I think at that point in time, it has to be a conversation with your healthcare professional. There's something called light therapy. I mean, we talk about psychotherapy and social cognitive therapy all the time. There are actually medications, antidepressive medications that can be given. And remarkably, we actually give vitamin D supplements to patients from time to time.
Okay, so what if the activities that you suggest aren't really working? What can we do?
Well, I mean, one of the things that I always tell people, right, is take a break, right? Give yourself some grace, right? There's a slide that we had before that sort of talked about this can be a crazy season, and a lot of times people can get overwhelmed. You can feel like a shaken snow globe. Take a time to step back. Enjoy coffee, tea if you're not a coffee drinker, and just don't put pressure on yourself. If and when that doesn't help, then, like we have on the resources slide, there's a lot of resources in our community that people can reach out to.
Very helpful tips there. So we will definitely be keeping those in mind, of course, during the holiday season. But before you go, December 15th is Toy and Gift Safety Awareness Month. Now, this is important, especially with Christmas just around the corner. So talk about this a little bit.
Yeah, so I think one of the things that people forget is that when they're giving toys to kids, not all toys are kid appropriate. They can have little pieces, they can have magnets, they can be choking hazards, they can have sharp edges, which can cause cuts and bruises. And so again, when you're thinking about giving a kid or whoever it is a gift, make sure it's child appropriate. And also, kids can also start to eat the wrapping paper. So throw away that wrapping paper, don't leave it around the house, and make sure that your Christmas is happy and festive.
Dr. Alozi, thank you so much for those helpful tips. Thank you so much for joining us, and happy holidays.
Thank you. Happy holidays.